and proxy strips can be placed across the surface if needed, but frequently they are not needed. Proxy strips or steri-strips are used for minor superficial lacerations that do not warrant suturing. And this is usually the case when a wound has almost no tension on it, and the approximation of the wound is easily obtained. If this is the laceration, to apply the steri-strips, I have cut these down to size, and one simply applies one end to one side of the wound. Using one's finger to press the wound together, you apply the opposite side to the opposite side of the wound with excellent approximation. Now, it's important to remember that the wound needs to be treated appropriately prior to the closure. If it is dirty, it should be cleaned with anesthesia if necessary. With relatively minor wounds, a tissue adhesive can be used. These are cyanoacrylic glues. Dermabond is one of the makers. The cyanoacrylic glue works well for lacerations that are relatively minor. They're not on mucocutaneous borders. They're not heavily soiled wounds. There's no human or animal bite involved, no infected wounds. And they're not over the elbows or knuckles or any areas of marked stress, unless these are going to be immobilized. Now, once this is completed, it's okay to get it in a little bit of water, but you don't want to soak it in water. It's okay for a gentle bath or a shower. Now, as with any other wound, hemostasis is important. The wound needs to be cleansed, needs to be dried, and then the wound margins need to be approximated. Now, if any of the glue gets inside the wound, then you pretty much have to start over again, clean the glue off. The capsule is squeezed. The glue is then allowed to soak the tip. And then the wound margins are approximated, and the glue is brushed back and forth with the wound margins approximated, giving several seconds in between. Now you can see that it's now soaked to the end of the tissue. And just a few seconds in between to allow it to dry each time, or to almost dry. And each time the glue is painted back and forth, an extra layer is applied. And after approximately a minute, enough strength exists that you can release the wound. You want to keep the wound horizontal to the ground so that there's no dripping. And the wound is then held together for approximately a minute, and then it can be released. The dog ear repair is a technique used to repair the so-called dog ear scar that results from sutures that are placed cumulatively farther apart on one side of the wound as compared to the other. Some degree of undermining is usually important. For the dog ear repair, here is the excessive tissue. To remove that, we will make an incision essentially in this direction. Like this.